My name is Prof. Marleen Temmerman. I work at the Aga Khan University. I'm a Belgian national, but I've been working in Kenya for many years. I'm an obstetrician gynecologist by training, but I've also been a politician. I worked in parliament in Belgium, and I have been a director of the WHO, the World Health Organization, in Geneva. Now, the term comes from the World Health Organization, where a unit started talking about how can we reduce disrespectful care. Because it's not about violence. Well, sometimes, yes, it happens that women in labor, in childbirth, are treated with disrespect. They have pain, they are screaming, they are even beaten up or slapped in the face, etc. This cannot happen. Disrespectful maternity care is more than just obstetrical violence. The activity here that will be launched soon on obstetrical violence should actually be part of it, or should be renamed "We Fight Against Disrespectful Care in Childbirth." It's great that parliamentarians are calling for that they work with the women groups, with the healthcare providers, with everyone in the community to make sure that pregnant women are treated with respect, information, where dignity is there, and that we as healthcare providers, we do everything we can to make sure that the mom and the baby are treated as really two important individuals at that moment in their life. Sometimes women are treated with disrespect everywhere in the world. And healthcare workers are sometimes very stressed. They hear the scream, because when you deliver a child, it's painful. And you hear the primal scream, and when you are in a very busy maternity, you can hear that very often, very loud. It's not an excuse. But it leads sometimes to nurses who are overworked, overstressed, and doctors who are rushing from one woman to another. Also, we don't take enough time to inform women what can happen. And one of the things is, for example, a cesarean section, right? As a healthcare provider, you have to talk prior to the delivery to your patient what can happen. Normally, you have a normal vaginal delivery, but if something urgent happens, you don't have 10 minutes to go and sit and say, well, let me explain you. So you are very brief in your communication. You say, Mama, there is an emergency, we have to rush you to theater. Sometimes people don't understand. They are like, what's going on with me? And they feel that this is not good. Whereas, medically spoken, it is good. It is to save the baby. I think a lot has changed, because I worked here in obstetrics in the 80s, and I've seen much more disrespect and slapping patients in the face than nowadays. You can avoid a lot if you give good information, and if you treat the woman and also the partner, the husband, the family who is there, with respect. And I think that's what we are trying to train and to teach our young doctors, that it's not always what they think, but they also have to have this empathy with the people they work with. I think that is really important. But I really encourage that the parliament in Kenya, for example, would take it higher, because we still have a big problem here of what? Maternal mortality. Too many women are dying in childbirth. We do a lot of efforts, antenatal care and delivery care, but still, we don't do very well. So I think it would be good that our parliamentarians form a working group, task force, look also together with us, with the healthcare providers, the researchers, the ministry, everyone involved, looking at how come that we don't reduce our maternal mortality? What is wrong in our systems? Do we have to refer our women earlier? Do we have to give them better care? And I think we could really make a big difference if we kind of join forces, join hands with everyone who is concerned about the health of the moms and the babies. So that's why I'm pleading for the parliamentarians here to work with the regional to reduce maternal mortality, to reduce maternal morbidity. And part of it is respectful care. But there was never a group of lawmakers working around obstetrical violence. We all have to work together, not only the obstetricians, but the midwives, the nurses, the doctors, the community, towards more respect. Women are dying, not because of medical diseases we cannot treat. They are dying because the society has yet to decide that their lives are worth saving. My message to Kenyan women organizations, healthcare workers, to the women themselves is let's invest together, let's work towards reducing maternal and newborn problems. Let's join hands, work together, and work towards respectful maternity care.